Hello, my name is Daniel, and today I'll be presenting my analysis of the strength and limitation of assertive communications in health and social care. Communications is a fundamental skill in healthcare, influencing patient outcomes, teamwork, and the overall quality of care. If this presentation, in this presentation, I will explore what assertive communication is, its advantages and disadvantages, and how it is applied in real healthcare settings. I will also discuss how this communication style supports person-centered care and collaboration, and suggest ways it can be improved in practice. Communication refers to the process of exhausting information between individuals. In health and social care, this includes both verbal communication, such as speaking and listening, and nonverbal communication, such as body language, facial expressions, and tone of voice. Effective communication is essential because it ensures that patients understand their care, feel respected, and are able to express their needs. Poor communication, on the other hand, can lead to misunderstanding, errors, and reduced quality of care. Healthcare professionals must therefore adapt their communication style depending on the situation and the individual they are interacting with. What is assertive communication? Assertive communication is a style of communication where individuals express their thought, feeling, and need clearly and respectfully, while also considering the rights and feeling of others. It is often seen as a balance between passive communication, where individuals may avoid expressing themselves, and aggressive communications, where individuals may dominate or disrespect others. In healthcare, assertive communication is important because it allows professionals to provide clear information, advocate for patient, and maintain professional relationship. It promotes honesty, confidence, and mutual respect. Strength of assertive communication. One of the key traits of assertive communication is that it builds trust between healthcare professionals and patients. When communication is clear and respectful, patients are more likely to feel comfortable and confident. It also improves clarity, reducing the risk of misunderstandings, which is critical in healthcare settings where errors can have serious consequences. Additionally, assertive communication encourages mutual respect and support positive relationship within healthcare teams. This contributes to a more effective and safe work environment. Overall, assertive communication enhances both patient care and teamwork. Limitations of assertive communication. Despite its advantages, assertive communication also has some limitations. In some situations, it may be perceived as too direct, especially by individuals from cultures where indirect communications is preferred. This can lead to discomfort or misunderstanding. It may also be challenging to use assertive communication in emotionally sensitive situations, such as delivering bad news, where a more empathic or gentle approach may be required. Furthermore, assertive communication requires confidence and skill, which some individuals may need time and training to develop. Application in health and social care. Assertive communication is widely used in healthcare and social care settings. For example, during patient consultations, healthcare professionals use it to explain diagnosis or treatment plans clearly. It is also important when giving instructions to patients or colleagues, ensuring that information is understood correctly. In team settings, assertive communication helps professionals share information, raise concerns, and contribute to decision making. It is also useful when handling complaints, and it allows professionals to address issues calmly and respectfully. Person-centered care. Person-centered care focuses on the treating individuals as unique, respecting their preferences, and involving them in discussions about their care. Assertive communication supports this approach by enabling healthcare professionals to listen actively, show empathy, and communicate clearly with patients. This helps professionals better understand patients' needs and preferences, leading to more personalized and effective care plan. As a result, patients feel valued and more engaged in their own care, which can improve health outcomes. Collaborations. Effective collaboration is essential in health and social care as professionals often work in multidisciplinary team. Assertive communications plays a key role in teamwork by ensuring that information is shared clearly and accurately. It also encourages individuals to speak up if they if they have concerns, which is important for patient safety. By promoting open and respectful communications, assertive communication helps team work together more effectively and achieve shared goals. Suggestions for improvement. To improve the use of assertive communication in healthcare, several strategies can be applied. Firstly, communication skills training can help professionals develop confidence and effectiveness in their interactions. Secondly, increasing cultural awareness can ensure that communication styles are adapted appropriately, appropriately to different individuals. Developing emotional intelligence is also important as it helps professionals manage their own emotions and respond sensitively to others. Finally, a reflective practice allows individuals to evaluate and improve their communication skill over time. In conclusion, assertive communications is a highly effective communication style in health and social care, offering many strengths such as clarity, trust, and improved teamwork. However, it also has limitations, particularly in culturally sensitive or emotional situations where adaptation is necessary. Overall, professionals must be able to adjust their communication style depending on the context and individual needs. By doing so, they can provide high quality, person centered person-centered care and work effectively between teams. Thank you for your attention.